Our next guest heard the need for help and journeyed to the region to try and provide assistance. Here to tell us firsthand about her experience, Jennifer McQuiston, infectious disease specialist for the CDC, who also has quite a career as a New York Times best-selling romance author. Jennifer, we welcome you with that varied resume here to America's Forum.
Thank you very much. Glad to be on.
Now, Jennifer, you recently returned from Sierra Leone. As you think back about that trip, what stands out most in your mind?
You know, I've worked at the CDC for 16 years and I've been involved in a lot of disease outbreaks. But when Ebola hit, and it just seemed to get bigger and bigger, I think it became clear that this was going to be an all hands on deck kind of moment. And I felt like I needed to go and do what I could to help stop the outbreak. And that's really all I was thinking as I went.
And as you got there, what did you find? Did anything fall into the category of shocking?
Well, I was actually going in a very specific role. I work with the Office of Communications for CDC now after having worked as a disease detective for many years. And I knew that communications around Ebola were really what is going to contribute heavily to the stopping of this outbreak. I knew that communicating the right information to the right people at the right time was really going to save lives. And so what I was going to do in Sierra Leone was work on health communications. I was working with journalists. I was working with the disease detectives out in the districts who were actually working with people under quarantine. And so I wasn't doing anything that I think was shocking. I was simply working with the people who were there.
And mindful that you were on the ground there dealing with communications, now through your graciousness and Skype, you're able to communicate with all of America via Newsmax TV. From your perspective, here at home, what should we know about Ebola? What should we keep in mind?
You know, Ebola is a disease that is quite frightening to people. The more you know about it, the more frightening it becomes. But what I would say to people is that understanding the disease, understanding how the virus is transmitted, how it works, should actually be reassuring to the American public. In Africa, Ebola is spread through very close contact. It's not spread through casual contact, and it's really being spread through families caring for loved ones or attending funerals of people who have died from Ebola. And the situation in West Africa is markedly different than what we have here in the United States. We're also learning a lot about Ebola as this outbreak continues. And, you know, Ebola has this reputation of being incredibly lethal, and it is. It's a very contagious, has a high degree of fatality associated with it. But what we're learning is that early treatment for Ebola, meaning people who go and get early medical care, and they do things to stay well hydrated, meaning they're drinking a lot of water or they're drinking oral rehydration solution, have a much better chance of surviving Ebola than people who seek treatment late. And that's really the message we're trying to communicate to people in West Africa now. We want them to go and seek early medical care so they're more likely to survive.
And Jennifer, when you returned home from Sierra Leone, were you under any type of quarantine, or did you see firsthand any patients, or just deal with the infrastructure of communications there in Sierra Leone?
I was not sent to do direct patient care. I never saw a patient with Ebola or a patient who was ill for that matter. I was working with the health professionals in Sierra Leone and also with the non-government organizations who are there in the country working hard on communications. And I feel fortunate that I was able to go and help, but also know that I was safe while I was there. So I fall into a very low risk category in terms of my potential exposure. I basically never came in contact with anyone who was sick during my time in Sierra Leone. What that means coming back, though, is that I'm checking in with both the CDC and our state health department. I'm monitoring my temperature twice a day, and I'm looking closely for symptoms. But the truth of the matter is, if you don't come in contact with a sick person, there's no chance you could have Ebola. So I'm quite confident in my safety.
Less than a minute remains, but I got to ask you the question. A varied career. There you are with the CDC, and there you are, a best-selling romance novelist. What's the appeal of romance writing? About 30 seconds.
Well, I've always been a very avid reader, and you can imagine working at the CDC tends to be very scientific. And so I think it just was a creative outlet for me. It really helped me understand better how to communicate with people, though, I think. And so it has translated into my role now as a scientist, but also in Sierra Leone. So I feel really fortunate that I can bring those two interests together in this way.
And Jennifer McQuiston, we thank you for bringing all of your talents to bear and sitting down with us for this Skype conversation. Thank you so much for your insights and analysis on what's going on in Sierra Leone. And America's Forum will continue after this.